Hello everyone, welcome back to my YouTube channel. Today we are going to talk about anatomical terms related to position. So let's start our topic. We will start our topic with the importance of these anatomical terms. They are important to understand and apply anatomical terminology related to body position, direction and orientation in medical and scientific contexts. Now let's talk about anatomical position. The standard reference position is when body standing upright facing forwards, arm at the side with palms facing forward and feet slightly apart. Here you can see the pictorial representation of anatomical position. Now we will talk about the directional terms related to anatomical position. The first is superior, that is also called as cranial. It means closer to the head as the eyes are superior to the mouth. The second direction term is inferior, that is also called as caudal. That means further from the head or closer to the feet, as stomach is inferior to the heart. The next direction term is anterior, that is also called as ventral. That means towards the front. As you can say that sternum is anterior to the spine as it is towards the front. The next directional term is posterior, that is also called as dorsal. That means towards the back, as the spine is posterior to the heart. Next direction term is medial. That means closer to midline of the body, as the nose is medial to the ears. The next direction term is lateral. That means further from the midline. As we know, the arms are lateral to the chest or further from the midline. Next anatomical or directional term is proximal, that is closer to the point of attachment, as the shoulder is proximal to the finger. The next directional term is distal, that means further from the point of attachment, as the wrist is distal to the elbow. The next directional term is superficial, that means near the surface. As you can say, skin is superficial to the muscle as it is near to the surface. The next directional term is deep, that means away from the surface or more internal, as lungs are deep into the ribs or more internal to the ribs. So this was about the directional terms related to the position. Hopefully you like the video. If you do, don't forget to like, share, subscribe and comment. Thank you for watching.